Hi, and welcome, or welcome back. It's been a while. You're listening to the Perio-Patient Podcast, a podcast for my patients and anyone else who cares to listen. My name is Dr. Ben Young, and I am a periodontist in private practice in San Antonio, Texas. This is episode 100, and the title is, What is a Crown Lengthening Procedure, and How Long Should You Brush Your Teeth? I hope you're doing well. Crown lengthening is a confusing name for a procedure, and I wish I could change it, but it is embedded into the insurance procedure codes, so the best I can do is help you understand what it is. Perhaps a better descriptor rather than lengthening, because we're not stretching the tooth or making it longer in any way, would be to describe it as exposing. We are exposing more crown. There are essentially two reasons we would want to do this, and neither have to do with periodontal disease per se. In fact, these procedures imply periodontal health. And because this is the case, it is important first that we rule out periodontal disease in order to correctly submit for insurance reimbursement. The first reason to perform a crown lengthening procedure is for aesthetic reasons. If the tooth or teeth involved in the smile are covered by the gums so that the entire crown is not exposed, then the procedure would be to expose that part of the tooth, the crown. When we do this, there is an immediate result of a bigger, brighter smile. These procedures are usually performed on young people, sometimes at the completion of orthodontics. Sometimes when attempting to treat this gummy smile problem, dentists will attempt to remove the gums only to expose the crowns and not address the position of where the bone is relative to these crowns. This often results in a relapse. The gums either grow back to where they were before, or they might show some improvement, but not as much as initially expected. Again, this is because often the bone under the gums is in the wrong position relative to the crowns. When this is the case, the gums will always heal in a way to protect the bone. We call this protective distance the biologic width. In other words, bone is designed never to be exposed. It remains healthy and is protected by the skin, which in the mouth we call the gums or gingiva. The soft tissues protects the bone from bacteria and also is the source of the bone's primary nourishment, meaning the blood vessels are coursing through the soft tissues and then intercept into the bone. When bone is exposed, say at the time of an extraction of a tooth, the gums, as part of the healing phase, quickly grow over the exposed areas through cell replication. Applying this understanding back to the gummy smile, where the crowns are hidden by gums, it is usually necessary not only to reshape the gums, but to also reshape the bone to provide that biologic width necessary so the gums will recover in a new position. This enables both the crowns of the teeth to show, but also that the bone surrounding the teeth is adequately protected. The second type of crown lengthening is not for aesthetics. It doesn't have to do with a gummy smile. This does not mean, however, that the aesthetic upper front teeth are excluded from requiring a crown lengthening procedure for this second reason. Why this distinction is important for you, the patient, to understand has to do with dental insurance. Usually, if the reason for the crown lengthening is for aesthetics, the insurance company will possibly, very likely, reject the claim. This does not mean that the procedure is unnecessary. It might be because the gums failed to grow to the correct positions in the first place. But this will be a narrative fight with insurance. What I mean is, it's wise to obtain a pre-authorization for crown lengthening procedures anytime the front teeth are involved. The second type of crown lengthening procedure is needed when there is not enough crown of the tooth left to restore. This is due usually to earlier fillings or crowns needing to be replaced, but now once crowns or fillings have been removed, there just isn't enough tooth structure left above the gums to work with. Now the crown portion, which may involve part of the upper root of the tooth, the dentin, not just the enamel, also needs to be exposed. This means, just like the aesthetic crown lengthening, the gums and bone will need to be reshaped so they will heal in a position that allows the restoring dentist access to enough tooth structure to build upon. Here is what you need to know about this second type of crown lengthening procedure. Usually, it will only work one time. What I mean by this is that it usually is not in the best interest of you, the patient, to lengthen beyond what was achieved the first time. This is because our back door, should this tooth be lost, is to preserve enough bone in order to place a dental implant. But even if a dental implant is not desired, the preservation of bone and gums are still important, even if a bridge is to be placed. Also, the second crown lengthening may not result in enough good tooth structure to even accomplish what we're trying to do. Teeth are only so large to begin with. So here is when a crown lengthening or exposing procedure is useful. If you have enough tooth structure to place a crown that will last at least 5 or more years, then it is usually a good option to consider. It means you are choosing to keep this tooth a little longer, rather than replacing it. This gives you the opportunity to prepare for its replacement sometime in the future. It is buying you some time. This is an important principle you as a patient do well to understand when becoming involved with these types of advanced surgical and restorative procedures. And it's this: the more complicated the dentistry that's needed, the more possibilities of failure or a shorter lifespan until the next restoration. If you can get 5 years out of something like this, then it is an excellent option. But don't believe that this fixes these types of problems permanently. They might, and then they might not. Which brings me to my final point about crown lengthenings, and one useful for everyone listening, whether or not you ever need such a procedure. Prevention of problems is always the most economic approach to dental care. It is especially important for those who have a history of tooth decay, extensive restorative work, or periodontal disease. Continuing to return to have teeth and fillings checked and pockets around teeth measured is incredibly valuable because it can keep dental work costs down to their minimum necessary requirements. Remember, most disease processes in the mouth are for the most part silent. I had a patient recently who stated what many unfortunately believe. He said, "Well, it doesn't hurt, so it can't be that bad." Yes, it most definitely can be bad, even when it doesn't give the individual any warnings through pain. Many live with low-level pain as well, simply believing that the fact the pain is low level, the problem is small as well. Pain and the severity of a problem may not be connected at all. Self-diagnosing dental problems based on how the teeth and mouth feel can delay seeking care until the problems are big and much more expensive. Best to see dentists and dental hygienists on a regular routine basis. Which finally brings me up to the last topic, which is how long should I brush my teeth? This is a common question, and it goes to the idea that there is a certain amount of time that if you cross it by brushing, you will not have problems. I'm going to argue that that's not the way to look at this at all. I would rather have you understand what it is you're doing with a toothbrush and dental floss with regards to prevention of diseases, rather than thinking about it as something you do for a certain period of time and that should be enough. For example, if you were to just brush real hard on one side of your mouth and not the other, of course, the one side might not have bacteria problems, but they could have injury problems because you're over brushing. So my idea is that if you understand what it is you're trying to do with the toothbrush, then you'll figure out how much time would be necessary. And I will tell you, it probably isn't that much time per time you do it. In other words, I'd rather have you be thinking about frequency, not intensity. If you are an intense brusher, if you brush your teeth like you're polishing your boots, then you're abrading your tissues. And then we have to see you for gum loss due to that kind of a brushing habit. Not a good idea. So you need to do something that will disrupt these bacteria colonies. And I will tell you, there's no strength involved. They're not attached by glues that are difficult to remove. All you have to do is put the bristles of your brush in the proximity of these bacteria and wiggle it around. You've disrupted them off of where they're attached. They're going to float away. Your saliva has antibodies that will attach to them, and they will no longer be able to attach to you. You'll probably swallow them as you do saliva, and your stomach acids will kill those organisms. But then you'll have new ones that come in, and they'll grow and attach. And so it is the frequency that you need, not intensity. In fact, I would say if you're brushing at an 80% effectiveness rating, in other words, you're missing a little plaque here and there as you brush, if your frequency is correct, then you'll pick it up the next time. And that 12 hours between brushing, if that's the interval, twice a day, should be fine. It shouldn't cause, you shouldn't be breaking down with periodontal disease and tooth decay because you failed to brush in the last 12 hours. So that's the way I want my patients to be thinking about how much to brush. Be gentle, be frequent. And if you are doing it that way, then you're doing as much as I would want you to. Anything you're trying to do both with flossing and brushing to treat a disease, you're making a huge mistake because they're not intended to treat. They're intended to hold back or prevent, but not indefinitely. That's why there has to be this relationship between you and your dental hygienist and dentist, and at times with me. Well, that's it for today. I hope you found this helpful. If I have left you with a few questions, let me know. You have been listening to the Perio Patient Podcast. I'm still Dr. Ben Young. Thank you as always for listening. Bye for now. My dad unfortunately passed away when we couldn't remember his blood type. His last words to us were, "Be positive. Now go